Here's kind of a general layout of our facility, and I'll talk about each one of these areas in a little more detail. We have our, at the bottom we have our pilot manufacturing facility. Just behind that we've got our quality control labs, and above those our process development labs. The new manufacturing facility is part of our overall facility. That's at the top here. We have a CGMP warehouse that we recently expanded to, as well as some supporting utilities. Here's a zoomed in view of our pilot manufacturing facility. We have on the left, we have an entrance for personnel on the bottom and materials on the top. We have a common hallway that leads to separate areas for buffer preparation, upstream manufacturing or fermentation, downstream manufacturing or purification, as well as vialing and vialing preparation. Our pilot facility has clean areas that range from ISO 8 or class 100,000 to ISO 5 or class 100. 100,000 and 100 refer to the number of particles that are present in a cubic foot of air, so a lower number is a cleaner area. We have supporting utilities that are dedicated to the pilot facility, and those include purified water, clean steam, process air, and an automated clean in place skid. On the top is a picture of the fermenter in our pilot facility, and on the bottom is some tanks that are used in the purification process. We do the filling in our pilot facility. Filling is performed in the cleanest area, which is an ISO 5 or class 100 in the European Union. That's referred to a grade A environment. Our filling process is fully validated to be able to produce thousands of vials without producing a non-sterile unit. It's also monitored very strictly following international regulations to provide assurance that we're consistently filling product and not producing a non-sterile unit. And we can fill up to about 5,000 vials per batch. Now I want to talk a little bit about our commercial launch facility. It's designed a little bit different than our pilot facility. The upstream areas on the bottom and the downstream areas on the top. There's separate areas on the left for raw materials to come into either the upstream or the downstream. Personnel come in on the right, either to the upstream here or the downstream this way. There's also a common wash area where dirty equipment can come here. It's washed, it's needed, it's sterilized, and then you can go back to the respective area. The commercial launch facility also has clean areas that range from ISO 8 or class 100,000 to ISO 5 or class 100. We call it the commercial launch facility because it's the facility we'll use, and it was built to produce the first commercial batches of AEI Tech-20. We're also going to switch over and start beginning to make clinical batches for some of these trials we've talked about in this facility. The main reason to build this facility was to increase the capacity. In our pilot facility, we can make about 10,000 vials per year. In this new facility, we'll be able to make well over 200,000 vials per year. It's due to several reasons. One, just the increased scale, the increased efficiency at multiple steps, as well as decreased manufacturing time. Here's a view of some of the equipment in the upstream manufacturing. This is the fermenter. Over here, this is where we grow up the cells. It's a centrifuge that's used to harvest the cells. It's a machine that's used to break apart the cells. This gives a little bit more of an overall view of the upstream manufacturing area. There's some portable mixing tanks that are used in the harvest process. Here's a look at some of the pictures of the downstream facility. We have some chromatography skids and columns that are used to purify the protein. On the bottom right here, we have a single-use container. We use a lot of single-use technology for storing buffers as well as storing processing intermediates. On the top right is the machine that we use to get the ADI into the proper concentration and the proper formulation buffer for clinical use. So in addition to building a new manufacturing area, we built a new clean utility area to support that. Clean utilities refer to utilities that contact the product contact surfaces, or in the case of water for injection, become a significant part of the product. So that we have an extensive list of clean utilities to support the manufacture, include purified water, water for injection, clean steam, process air, oxygen, nitrogen, ozone, as well as an automated clean in place unit. And then we have some non-clean utilities. They don't contact the product, but they're important in the manufacture. We have plant steam, we have a cooling water system, an instrument air system, and we have a diesel generator that will automatically start if we lose power from the city and back up some of our critical systems. We have a GMP warehouse. We use that to store both raw materials as well as store final products. It's GMP because it's temperature controlled, it's access controlled. We have an electronic inventory tracking system. We also have validated final product storage containers. One of the important parts of the GMP manufacturing facility is the quality control group. Here's a picture of our quality control lab. And we divide our quality control group up into two groups, our analytical group and our microbiology group. The analytical group is responsible for performing testing on the strength, potency, identity, purity, and safety of ADI-PEG20, as well as various process intermediates and starting materials. In addition to testing materials as they made, they test each lot several years after they're made to demonstrate how stable it is and prove that it's stable. Our quality control group has the ability to develop new methods, improve existing methods, and validate those methods following regulatory guidelines. The microbiology group in quality control is responsible for monitoring the quality of the manufacturing areas, demonstrate that they're meeting the ISO requirements, ISO 5, ISO 7, ISO 8. They also do a lot of testing for microbial growth in the manufacturing areas, make sure that they're free of microbial growth, surface contact plates on floors, walls, door handles, equipment surfaces. A big part of their job is to monitor the quality of the supporting utilities. So they check and make sure the water, the air, the steam, those are all producing what they're supposed to, and they're producing the quality that they're supposed to. They also test the microbiological properties of the process intermediates. Another group that's important in a GMP facility is the quality assurance group. We have a very experienced quality assurance team that's committed to complying with all of the appropriate regulations. They have responsibility for release of all drug product components before they're used, different process intermediates, and most importantly, the final products. They also have responsibility for conducting internal and external audits. So internal audits, they audit the other manufacturing people, the quality control people, other people in QA, make sure that we're following GMPs as we're making and testing products. They're responsible for external audits of our raw material suppliers. And a few contract testing labs that we use, they're responsible for auditing them. And most importantly, they're responsible for handling audits of Designer X by different regulatory agencies. And in the last 10 years, we've had a total of 7 different regulatory inspections. 2 by the State of California Department of Health, and the State of California conducts CGMP inspections following the same regulations as the United States Food and Drug Administration. The US FDA will come audit us when it's just before the drug's approved. It's called a pre-approval inspection. They could come earlier, but we wouldn't normally expect the FDA to come audit us during the early clinical trial or even the phase 3 clinical trial manufacturing stage. But the State of California does commonly conduct CGMP audits. In addition, we've had a number of audits by European Union qualified persons. In the EU requires a third-party CGMP inspection every 2 years when conducting clinical trials within the EU. We work with different QPs on different clinical trials, and that's why these audits tend to be a little bit more frequent than once every 2 years for us. The most recent audit we had was in March of 2016. This is an EU qualified person audit. And those audits, the observations are classified by severity, with critical being the most severe, major being the next severe, and minor being the least severe. This audit, we had no critical observations, no major observations, and just one minor observation. And because the audit went well and we passed the audit, we got issued a European Union Qualified Person GMP declaration. These need to be issued for every trial. This is a copy of the GMP declaration that was issued for the atomic mesothelioma trial that's been talked about earlier. And in addition, the state of California, to successfully meet the GMP requirements, they issued a drug manufacturing license, and this is a copy of our current drug manufacturing license from the state of California. Thank you very much.
Question for Chris?所以我后面这一段我也用中文说好了，这是个 strategy。那个在我还没开始说之前，我们既然那个龚勤健龚老师现在查龚的，龚老师是从一开始2003年就一直跟我们，本来要做 tyrosine kinase， 后来做了 ABI 的 project。龚老师有很多很有意思的data，今天还有中评院的院会结束的比较早，所以龚老师来这边参加。我记得我们4年以前第3次的 symposium 的时候，龚老师开始讲了，然后那个国警的警报就起来了，龚老师坚守岗位把东西说完了。就今天台风来了，龚老师也来这边参加，所以非常非常感谢。因为等会我们还跟龚老师讨论一些其他的事。